Hi, everybody. As we've been talking about over the last couple of days in my videos about what dyslexia is a spectrum disorder that affects 15 to 20% of the population, and it affects everybody differently. And a big reason it affects everyone differently is because of comorbidity with other common disorders or disorders commonly occurring with dyslexia. This video is not comprehensive. There's a lot that could be said on this subject, and I can't go into each of the different disorders that commonly occurs with dyslexia. If you would like to share more light on this subject, please feel free to comment in the section below, in the comments below. So what are the common coexisting diagnoses that go with dyslexia? According to the IDA, the International Dyslexia Association, 25 to 40% of people with dyslexia have ADHD. The results of a study published in 2013 show comorbidity with neuropsychopathologies in 62.2% of the study group. The group consisted of 448 patients ages 7 to 16 with a diagnosis of a learning disability, either specific or not otherwise specified. And some of the co-occurring conditions that they mentioned in their study were ADHD, Autism Spectrum Disorder, Disruptive Impulse Control and Conduct Disorders, anxiety and depressive disorders, language disorders, motor coordination disorders, and other specific learning disorders. That's a lot of disorders. No wonder my kids' room is a mess. On a non-scientific website, I found a nice diagram that lists other commonly coexisting disorders. And the links to everything I am referring to are in my description. The disorders that are listed on that website were auditory processing disorder, visual processing disorder, dysorthography, dyspraxia, dysgraphia, and dyscalculia. And today, an associate of mine told me that her daughter, who is dyslexic, also has something I had never heard of before, a nonverbal learning disability. And I put a link to what that is in my description. According to this published study called Recognizing Psychiatric Comorbidity with Reading Disorders, there might exist comorbidity between reading disability and substance-related addictive disorders. However, the study states that there's conflicting research on this and more research needs to be done, or conflicting studies and more research needs to be done about that. So why do these conditions commonly occur together? Well, a study on this subject found that distinct neurodevelopmental disorders have a common genetic etiology that explains the high degree of comorbidity among these disorders. In other words, shared genes or similar genes affect these disorders. And they mapped out the genes that cause these common comorbid disorders. So I thought that was really interesting. Now, distinguishing between these different diagnoses can be tricky. It's hard to separate them into neat little categories because they overlap and a lot of them share the same symptoms. So it takes a lot of research, which can seem overwhelming to me anyway. As a mom, I already feel like I have so much to learn about dyslexia. Now I need to learn about all these other things that I see symptoms of in my child. But just take it a day at a time. And how do we help our children with multiple learning differences and different conditions? According to understood.org, they said each learning or mental health difference needs to be approached on its own. A school evaluation can pinpoint specific things kids are struggling with. But another article in understood.org says that sometimes a diagnosis doesn't always lead to effective support because a study showed that many children in a certain Well, many children in a certain study were not receiving services in the areas where they actually had weaknesses. The study collected data from 530 children referred to a clinic by educators, and the kids were evaluated on their listening skills, spatial reasoning, problem solving, vocabulary, and working memory. They were also given an MRI scan, brain scan, and their parents completed behavior questionnaires. And the researchers found that a child's diagnosis didn't predict their cognitive profile. In other words, diagnoses didn't match up with patterns of test scores, nor did diagnoses correlate with brain function shown by the MRIs. So, in conclusion, just keep on trying to get the right help for your child. We have a lot to learn to help our kids. I found it really helpful to talk to other parents on Facebook support groups. And I put links to those different support groups, the Facebook support groups, in my video called What to Do When Your Child is Diagnosed with Dyslexia. And as always, if you found this video helpful, please like, share, and subscribe. I'm trying to reach 250 subscribers now. And my channel is to help parents of kids with dyslexia and ADHD. I make videos every Tuesday, Thursday, and Saturday. So I will see you next time.